With more than 25 years' experience, at CHS Healthcare we understand what is required to choose the right hoist sling and hoist solution. When moving and handling a person, choosing the correct hoist sling is important in providing appropriate support to people whose health or disability has left them with different levels of functional mobility, from completely mobile and independent to those who are entirely bedridden. In this video, we will outline what you need to consider in choosing the right hoist sling for your needs. CHS Healthcare is an Australian family-owned company who has specialised in patient lifting and handling solutions for over 25 years. We understand the appropriate choice of equipment will depend on a number of factors.
Hello, I'm Lloyd Beer from CHS Healthcare, and I'd just like to touch briefly on choosing the right sling type for your client. This is a very common sling, a general purpose head support style of sling. They can come with and without head support, and this sling is designed, as the name suggests, it's designed for general transfers, so chair to bed, bed to chair to chair type transfers. They're a very supportive sling, very easy to fit, and then we also have a range of hygiene slings. These slings are designed for access, for toileting or showering. In terms of, they're also very easy to fit, but they aren't quite as supportive as a general purpose sling. So someone would generally require pretty good muscle tone to be able to tolerate one of these slings, as they do take a bit of weight through your shoulders. You can also get this sling in head support, with head support as well, which offers a lot more support than the non-head support version. The reason you may choose different sling types can depend on what sort of transfer you're doing. For example, if you're transferring from bed to chair, then something like a general purpose sling is fine. It offers a lot of support, including head support, and it doesn't rely on you having much muscle tone. If, however, you're doing a transfer that you require access, for example, if you're transferring onto a toilet or a shower commode, then you might want to use a hygiene style of sling, as this offers access for cleaning, showering, toileting, and also adjusting clothing as required. Now I'm going to run over some tips on choosing the right size sling. Obviously when you're fitting a sling, the label and the grab handles go on the outside of the sling, and the label's centered on the back of the sling. With a general purpose sling, this one has head support. With a general purpose sling, you want to make sure that the seam is running from the coccyx or the base of the spine, and then you want the head support to be sitting just above the patient's head. You don't want the seam sitting sort of mid-head or below, as the head support will drop down and dig in. So to fit the sling, basically you just need to slide this down behind the back until this seam is touching the cushion. You don't need to feed the sling underneath the patient, just touching the cushion. And then once you've done that, you bring the leg strap down. You want to make sure that seam is touching the cushion across the back, around the corner, and down the thighs. And you do that on both sides. And then at this point, just check that the leg straps are even, so that you know you've got the sling centered around the hips. It's very important to get the sling centered around the hips, and the top of the sling will fall into place. And then you just bring the leg straps underneath. Make sure you keep the leg straps nice and flat so they don't dig in. Don't let them bunch up. And then just check they're even again, and you can cross the leg straps over to keep the legs together. If you don't cross the leg straps, it's still quite safe, but your legs will splay. Once you've brought the hoist across, on the sling loops, there'll always be different loop options depending on the brand. Some have 3 options, some have 4 or 5. The point of these loop options is to lift somebody in an upright or a reclined position. Generally, if you want to lift someone in an upright position, which is probably the most common, you'd go a longer loop option on the legs. So we'll use the red strap on the legs, and then on the shoulders, we'll go a shorter loop option. So I'm using the blue, which is the medium option here. And then at this point, we'll just take up the tension on the hoist, and then before we lift off, just do our safety check, make sure the colours are the same and that the loops are on properly. So we've got red and blue. Your loops have to be the same colour left to right, but not front to back. And then also just make sure your sling's not caught on the chair anywhere. Make sure there's no seat belts on or shoulder harnesses, or the feet aren't strapped in, and then we're good to go. The other thing with this, there's a lot of different yokes out there. This particular hoist has a 4-point yoke, meaning that the leg straps, instead of coming back to a central point like they would on a 2-point yoke, it opens the sling up and gives you a bit more room in the sling. The leg straps don't ride up the leg. They go vertically to the hoist, and it gives you greater head clearance as well. And then at this point, we're good to go. Now I'm going to fit a hygiene sling. Just make sure the torso band is on the inside of the sling. And then again, this just slides down behind your back. Obviously a hygiene sling doesn't go down as low as the previous general purpose sling. And this roll of padding comes under the arms, the torso band comes through. Make sure your arms are on the outside of the sling so that the padding is underneath your arms. This is very important. And then fit the torso band low and tight. And then the leg straps come through. Making sure they're sitting nice and flat again, and then bring them through and cross. The CHS Healthcare offers a huge range of slings, from the standard general purpose head support and the hygiene slings, right through to walking slings, amputee slings, hammock slings, a huge range. We can also custom make slings to your specifications and needs as well. And in addition to that, we have a range of in situ or leave-in slings. These slings can be left in place in the chair if you've got a moulded backrest or a reclined chair where it's difficult to remove the sling and then reapply it, depending on your client, of course. But there is a couple of different fabric options. We have the Parasilk, which is very cool, very breathable, very easy to slide in place. These slings come with head support, which can be adjusted and tensioned. They also come with boning in the head support, which is removable. They're a very supportive sling. And we also have Superfine Plus, which is also an in situ breathable fabric, which is suitable for bathing and showering also. So it can be left in place in a commode chair or shower chair, for example.
Our services include site and home visits, where we can inspect your site and home setting and advise on the most appropriate installation method and products to suit your individual requirements. In some circumstances, we can assist with trialling equipment in your site or home setting to ensure it is practically suitable. In this way, you can experience clearance, circulation, manoeuvrability, comfort and support. In addition to ceiling and standing hoists and hoist slings, CHS Healthcare specialises in patient lifting rail systems and bariatric solutions, as well as a complete range of therapy baths, change tables, privacy screens and much more. We can design, supply, install, train and maintain patient lifting and handling equipment Australia-wide. Whether you are a state-of-the-art hospital, aged care facility, community centre, school or domestic location, we're here for you.